How many of you have younger siblings? You can go ahead and raise your hand. Okay, a few of you. What would be your first instinct to do if they're in danger or they're in trouble? You can go ahead and answer, anybody.
Defend them. I'd defend them.
Defend them? Okay, right. So you'd help them or protect them, right? Well, what would you do exactly? How would you protect them? How would you help them if they just started seizing right in front of you? Having a seizure right in front of you, what would you do?
911.
911. Right, but notice how everybody just kind of stopped. They don't really know what to do. Well, imagine them just shaking and spazzing right in front of you, uncontrollably. You think that they're really helpless and they're just sitting there in front of you and you really don't know what to do other than watch them and try to make sure, they don't fall or hurt themselves. Well, what do you do when they stop? Are they going to be the same? Will they be coherent? Are they going to be conscious in front of you? And will it happen again? Are you worried that my first instinct would be are you worried that it's going to happen again or when it's going to happen again? Well, all these questions started going through my mind when my brother had a seizure in front of me in the middle of the grocery store. I can assure you that his life changed, and as well, mine dramatically changed through that, and nothing will actually be the same. So, what is a seizure exactly? Well, most of the people have a right idea about it, but I'm going to go ahead and give you the definition. This is just plain from the dictionary.com. You can look it up from anywhere. Okay, a seizure is a sudden episode of transient neurologic symptoms such as involuntary muscle movements, sensory disturbance, and altered consciousness that usually last up to 60 to 90 seconds. A seizure is caused by abnormal electrical activity in the brain. So basically, you really do shake uncontrollably. You have so much electrical activity, more than you should have, in your brain that you can't really control anything, that you literally just kind of freeze in time. And believe me, those 60 to 90 seconds seem like hours. Unfortunately, my brother's case turned into cases. He would randomly experience seizures throughout his life uncontrollably. But from that, I learned something that you can't really help change the cause, but you can help change the recovery. After experiencing a seizure, you can imagine there follows many doctor appointments and many specialized checkups. And yes, one of those are actually specialized appointments is called speech pathology. Right, you go to a speech pathologist. Most likely, after having multiple seizures, the abnormal electrical brain activity often messes up the ability of your speech. It hits a nerve in your brain that normally, that's probably the first thing to go after you have a seizure, is your ability to speak after your pronunciation. Speech pathology is normally called speech therapy, or preferred term speech-language pathology, or SLP. In the profession devoted to assessment, habilitation, rehabilitation, counseling, and prevention, serving for individuals from birth through old age who have some type of speech, voice, language, cognitive communicating, or swallowing disorder. Typically, young and old patients have to relearn sounds, and they have to relearn how to pronounce them, or anything, or what sounds really are and how to make them. Through this experience, I've learned personally that you really need to be patient with anything that happens. I'm going to show you a little clip of exactly what a speech pathologist would do in action.
He's an actor who's known for his voice, but his accident took that away. Thankfully, Thankfully, he's got Aflac. They're gonna give him cash to help pay his bills so he can just focus on getting better. We're taking it one day at a time. One day at a time.
See how the duck's less.
Okay, so most of you have seen that, but maybe most of you have not thought that that's really what speech pathology is. You have to enunciate in weird ways, laugh, in different ways in order for them to really understand, because usually they lose their whole tone and they really don't know how to tell which one from which. Through this experience, I've learned personally that I want to be able to help young and old through these tragedies in their lives. Acting upon this dream, I'm currently a psychology major and will be studying speech therapy or speech pathology to become a speech path in hopes to become a speech pathologist so that I can make a difference in people's lives just like my brothers.